What is an appendectomy? An appendectomy is a surgical procedure that is performed on the patient's appendix. Most commonly, the patient has something called appendicitis. Your appendix is a small tube-like organ which is attached to your large intestine. But why are appendectomies performed? The main reason for an appendectomy is appendicitis. This is when your appendix is inflamed or infected. If not treated, your appendix can rupture, which can be life-threatening. But how are appendectomies performed? There are two approaches used to perform this procedure: laparoscopic or open. A laparoscopic appendectomy is less invasive. It is performed by creating a small incision in the abdomen. A laparoscope, which is a tiny camera, is inserted and helps guide the surgeon in removing the appendix. This method is less painful and has a shorter recovery time. An open appendectomy is performed by creating a large incision in the lower right abdomen. The appendix is then removed through this incision. This is more commonly used when the appendix has ruptured or is infected. This is because the procedure typically has a slightly longer recovery time. For comparison, a laparoscopic appendectomy allows you to head home the day or the next day, whereas an open appendectomy requires a few days in the hospital and a 4 to 6 week recovery. Appendectomies are some of the most common procedures performed.